the DG, all colleagues, members of the Fourth Estate, good afternoon. First, Waziri, I would like to give my special thanks to His Excellency the President for his consideration to appoint me as Principal Secretary, State Department, Medical Services. I take this as a great opportunity to deliver on the plan that he promised Kenyans. Secondly, CS, I would like to thank you so much because you have enormously supported me during the process of vetting. Being a former majority leader in the National Assembly, you have a language with your colleagues, and your phone calls, your help, even the documents that you sent me to read. Thank you so much. It has all worked. Waziri. Thank you so much. I know it's not an exam, Waziri, but I did complete reading all of them. But it's simply because the time couldn't allow. But now that I'm with you, I'll read all of them, sir, and make sure that we are aligned to your pledge as well. To my colleague PS, who I have to mention is my former boss, having been the acting head for health sector coordination, I want to thank you for the support and for placing me in a position that I could be noticed. I want to especially thank all my colleagues who are here. I think you've been part of my journey. CS, it is some 13 years and 5 days since I first picked my letter of appointment from this building as a medical officer. I had just completed a one-year internship at Kijabe Mission Hospital, and then I went back to work in the Kijabe Mission ICU for some 3 more months. Had a short stint after that in Outspan Hospital in Nyeri as the medical officer doing internal medicine. Then I was graciously posted by the government to Vihiga County, where I was the medical officer in charge as well of the medical wards. And I spent more than 2 years there. Came back to Kenyatta National Hospital, spent more than 5 years there. And in that period as well, I have been with my colleagues in the streets and also in the boardrooms. First in KMPDU and then transitioned to Health Workers for All Coalition. Did a bit of work with the WHO, HRH. I have also had the stint to engage with government at policy levels from the Health Act 2017. We have been part of the journey, as our colleague PS Harry mentioned, developing the intergovernmental participatory agreements for most of the programs this ministry runs. So Waziri, I have been around for those 13 years. And in those 13 years, I have had the privilege to gather a lot of networks, to know a bit of the sector. And I think this is the privilege that I bring, that I have been in every space. I've been in the faith-based hospitals, I've been in the government hospitals, I've been in the private hospitals, I've been in the civil society movement, I've been part of government pushing for policy. I worked in NMS, where we did quite a bit of work to reduce maternal and neonatal mortality. And I want to bring that collective experience here, Waziri, under your leadership, so that we could move healthcare forward. Waziri, a lot has happened. My colleague and PS Mudhoni, I think they have been part of the journey. The overhaul of the health systems through the 4 laws that were passed by Parliament has placed a legal framework that could usher in a new era of healthcare. But sir, with that overhaul, there has been also need to bring everyone along. I have listened to you speak yesterday in Parliament. I have listened to the President speak. I have listened to a number of people speak. And I can summarize 3 things that I would request under your leadership and with the support of my colleagues and the entire sector that we focus on. One, on top of that agenda, is to rebuild public trust in our healthcare system. And that is something that is urgent, and that is something that we must do. And sir, I have heard you mention chapter 10 of the Constitution. And this is music to my ears because I believe I live patriotism, I live professionalism, I live integrity, I live transparency. I live the public good, I live sustainable development. And all those aspects of chapter 10 of the Constitution is what builds public trust. And if there is one thing that we must do, is to rebuild public trust, not just for this ministry, but also for the health sector. Sir, you have mentioned the UHC implementation, Taifa Care. And I want to promise you, sir, that I will be dependable, I will be reliable, and I will be effective. You have called yourself the bulldozer. We know you are the bulldozer. Count me as one of the wheels in that bulldozer, because I will be dependable, reliable, and effective in this UHC implementation in all the 4 pillars as has been outlined in the plan. The human resources for health, where I have a background. And on this one, we must deliver a health workforce that is well before we can deliver a health system that is well. And on the issues of commodities, the security of our commodities, you have mentioned a lot, and I promise you to help you implement that. On the health financing, where the Social Health Authority is, partly building consensus, building that trust, moving our country forward in domestic resource mobilization. And lastly, on the digitization, that then brings the data to be available for decision making. Sir, the last bit, which you have also talked about going to address in the afternoon, but that is just, I think, a tip of the iceberg. And on this, I would like to address the sector, not just the ministry. We must bring order to the health sector. And that's the last bit that I believe will help us to implement UHC. How do we bring order? We must ascertain that all players and actors in the health sector must align with the objectives of our government. And number 2, we must enable them to do the things that give us results. Sir, with those many remarks, I want to tell my colleagues that I will be open, I will be transparent, I will be available, and I will be facilitative for you to perform the functions that you have been bestowed by the public service. I come from a background of discipline and commitment. I do not know how to work in a place that do not produce results. And so, sir, I kindly beg for your support that we deliver results. Thank you. For the public, I think change has come. Thank you.
I think we are